Hi there, my name is Dr. Nora and I'm a naturopathic doctor here in Vancouver. I wanted to talk about iron deficiency today because it's something that I see quite a bit in my practice, and with my practice being so focused on fertility and pregnancy, I definitely like to make sure that my patients have adequate iron stores, ideally before they get pregnant, for two reasons. Because blood volume increases in pregnancy and iron is involved in the production of blood and the production of red blood cells. And the second reason is because iron levels tend to plummet in pregnancy. I've seen them get really low kind of mid-pregnancy, even if a woman's iron levels were normal before she got pregnant. So it's definitely important to monitor those levels throughout pregnancy and make sure that they're not getting too low. Now, the problem with testing for iron deficiency is the reference range tends to be really big. So the reference range for a ferritin test, which is the way that we test iron in the blood, is anywhere between 15 to 250 nanograms per mil. And that's a huge range. So most of the women I see land somewhere between 30 to 40. I rarely see it go above that. And the reason that women tend to be chronically low in iron is because if you're cycling regularly, you're losing blood every month, meaning that you're losing iron every month. So that's normal. It's normal for women to have lower iron levels than men. But I do have a more optimal range because the normal reference range is pretty big. It kind of depends on which lab you're using, but it does tend to be on average between 15 to 250. My more optimal range is somewhere between 70 to 100, and the reason for that is because that's where I see women feeling their best and not displaying any of those symptoms that are associated with iron deficiency. The symptoms that I'm referring to are fatigue, hair loss is another one, dizziness either in general or when standing up too quickly, and low blood pressure. Those are the four kind of main symptoms that I see most commonly. So you can definitely still be symptomatic at a level of 30 and benefit from some sort of treatment, whether that's through a supplement or through a diet. Usually when I see someone in practice, they'll say that their family doctor tested their iron and they said that it was normal. So that's where it kind of gets, a lot of patients fall through the cracks because their doctors will tell them that it was normal even though they're kind of borderline, right? So I do tend to see that a lot, and I do tend to recommend some form of treatment for those patients. The easiest way to correct an iron deficiency is through supplementation. This way you can measure, you can take the same dose every day, and you can retest it in 2 months and see whether your iron levels are going up. Another way of increasing your levels is through the diet, right? It's a little bit harder to measure, but it's possible. You can increase your intake of red meat, for example. Red meat is a great source of heme iron, which is the most easily absorbed form of iron. Not everyone eats red meat though, right? So it's important to make that distinction of heme iron versus non-heme iron. Heme iron is, like I said, more easily absorbed by the body. Non-heme iron is not very easily absorbed, not very easily utilized by the body. So non-heme iron is what we find in plant sources like leafy greens or spinach or beans and lentils and that kind of thing. So I wouldn't rely on just plant sources. If you're really low in iron, I would definitely recommend supplementing with an iron supplement. My favorite iron supplement tends to be exclusive to the Vancouver area because it's made by the local compounding pharmacy here called Pure Pharmacy, and it's called Bob's Iron Formula. But I really like it because they add nutrients that help with iron absorption. So they add vitamin C, B12, and folate, and those all really help the iron get absorbed more efficiently. What I would recommend if you're not from Vancouver is seeing a naturopathic doctor and working with them and your local compounding pharmacy to create a similar formula. And that way they can customize the dose, they can add nutrients in that will help with absorption, and you can correct your iron deficiency pretty easily that way. If you have any questions, please let me know, and if you have any special requests for future videos, please leave me a comment. Thank you so much for watching, and I hope you have a wonderful day.